Hello friends, welcome to Expert Medical Coding. In today's video, we're going to learn about ICD-10 CM PCS updates 2024 first quarter part 3. In this video, we're going to learn two coding clinics. And the first one is, how should rheumatoid arthritis with inflammatory polyarthropathy be reported? And the second one is post-laminectomy lumbar spondylolisthesis reported as a post-operative complication or as a post-laminectomy syndrome? So let's get started with the first one. How should rheumatoid arthritis with inflammatory polyarthropathy be reported? Let's see the scenario. A 65-year-old patient presented for follow-up as well as for management of chronic conditions and complained of joint pain due to rheumatoid arthritis. The provider documented rheumatoid arthritis with inflammatory polyarthropathy in the assessment, with a steroid injection provided as treatment. So the question here is, how should rheumatoid arthritis with inflammatory polyarthropathy be reported? And the answer here is, we have to go in the index and search for the main term polyarthropathy. Under that subterm inflammatory, it will lead you to the code of M06.4. So we have to assign code M06.4 for inflammatory polyarthropathy in a patient with rheumatoid arthritis. ICD-10 CM classifies inflammatory polyarthropathy as a specified type of rheumatoid arthritis under category M06, other rheumatoid arthritis. Therefore, the more specific code, that is M06.4, is reported in lieu of code M06.9, rheumatoid arthritis unspecified. So code M06.9 is assigned when rheumatoid arthritis is documented without further specification. So in this scenario, we have more specification. So we have to assign code M06.4 for inflammatory polyarthropathy rather than code M06.9, that is rheumatoid arthritis unspecified. Now let's move to the next coding clinic. That is post-laminectomy lumbar spondylolisthesis reported as a post-operative complication or as a post-laminectomy syndrome? Now let's see the scenario. A patient who recently had lumbar decompression surgery was readmitted with progressive worsening of low back pain radiated down both legs. The patient was diagnosed with dynamic instability, lumbar spondylolisthesis, and cauda equina syndrome, prompting further surgery. During this admission, the patient underwent an L4 to S1 transforaminal lumbar interbody fusion with posterior instrumentation. Following the TLIF procedure, the patient continued to experience bilateral paresthesias with impaired sensation, and the provider documented post-laminectomy syndrome. A query was submitted to determine the cause of the spondylolisthesis. The provider's response to the query stated, the spondylolisthesis occurred in the post-operative period after a decompression laminectomy surgery, secondary to multiple factors, including the decompression surgery which weakened the posterior tension band, the patient's weight and obesity causing extra stress. So this is the response of the physician. Now the question here is post-laminectomy lumbar spondylolisthesis reported as a post-operative complication or as a post-laminectomy syndrome? So the answer here is, we have to assign it as a post-operative complication. The code will be M96.89, other intraoperative and post-procedural complications and disorders of the musculoskeletal system, and code M43.16 for spondylolisthesis, lumbar region, and G83.4 for cauda equina syndrome. As previously published in Coding Clinic first quarter 2022, pages 51 to 52, and stated in the official coding guidelines and reporting section 1.b.16, that it is not necessary for the provider to explicitly document the term complication. The cause and effect relationship documented between the surgery and the condition is sufficient. So, code M96.1, post-laminectomy syndrome not elsewhere classified, is not assigned when the condition is further specified by the provider as lumbar spondylolisthesis. So here in this scenario, the query response came as, the spondylolisthesis occurred in the post-operative period after a decompression laminectomy surgery. So with this link, we can take it as post-operative complication. So it's not necessary for the provider to respond as complication. The cause and effect relationship between the surgery and the condition is sufficient to consider it as post-operative complication.
Please like, share and subscribe to Expert Medical Coding. Thanks for watching.